Hi, Mrs. Garchova. Your results are in, and your blood pressure and cholesterol seem to be a little high.
Really? I've been taking my medication.
Have you been taking them?
Yeah, very, 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 all the time, every day. I have
Where's your purse, Mom?
What's right here? Let me see. Somewhere here.
Oh my God.
Somewhere here. Oh, there it is.
No.
I forgot to take it today, so let me take one.
Mom, your medications.
This is
I
it.
told you 100 times. Don't put the candies in the same cabinet as your medication.
Oh, it's candy. I
Is
like
it
chocolate.
low, Mrs. Garchova?
Yes, I do.
Do you help your mom out?
I don't stay with her all the time because she doesn't want me to, but I call her every day and I go to her apartment almost every day.
Mrs. Garchova, you need to be careful about mixing up your medication with candy. So that
But
explains
these
why your
taste very
blood
good.
pressure
They
is a
taste
little
very
high.
good.
Yeah, I know they do, but you need to be careful about that, and maybe you can help your mom out about organizing her
Yeah.
Почему ты на
medication.
меня так смотришь? Почему, дочерная?
Okay, Mom. Control yourself. I'm
Mrs.
sorry.
Garchova, have you been having any problems with your memory lately?
No, I don't remember. No, I think I'm okay.
Oh, you think? Okay, so just to be sure, we're going to be performing a little exam on you today, just to
Exam.
make sure nothing is wrong.
Со мной ничего, все в порядке. Почему меня должны проверять?
Okay, so the nurse, if that's okay with you, the nurse is going to be here in 5 minutes to perform an exam on you.
Дочка, мне нужно это делать?
Yes.
Nurse Judy, it seems like our patient is having some trouble with her memory, so we're going to be performing an exam to test for cognitive impairment. So the tests that are available are the MOCA, the clock drawing, the mini-cog, executive function, mini mental state test. And using the mini-cog exam compared to other tests produces fewer false positive results and has an 83% more accuracy. And in comparative tests, the mini-cog was at least twice as fast as the mini mental state test. And it's less affected by subject ethnicity, language, and education, and can detect a variety of different dementias. And the mini-cog also detects many people with mild cognitive impairments. And while you're administering this test to the patient, just be aware that it can cause anxiety if the patient is aware of making mistakes, and avoid limitations by providing a comfortable environment without distractions for the patient, and use appropriate volume when giving instructions during the exam to the patient.
Okay, sounds good. What would be the benefit of screening this patient?
Well, early identification of cognitive impairment reduces the patient and caregiver morbidity and allows patient and families to receive care at an earlier stage of the disease. And although the evidence of routine screening is insufficient, there may be important reasons to identify cognitive impairment. And as much as 29 to 76% of patients with dementia or probable dementia go undiagnosed in clinical settings. And therefore, we as clinicians need to remain alert to early signs and symptoms and screen for it.
Right. Okay, sounds good.
Okay, so she's going to be in room 2.
All right, thank you. Hello, Ms. Garchova. My name is Judy. I'm your nurse, and I'm going to be performing mini-cog exam on you today, okay?
Is it gonna hurt?
No, it's not going to hurt.
Well, what's mini-cog exam?
It's actually exam to evaluate your memory and thinking, and it's going to take about 3 to 5 minutes. Jana, would you mind stepping out of the room while we do it? Thank you.
Пока, доченька.
Okay, now I'm going to explain to you how we're going to do it. So I'm going to give you 3 words that I want you to remember, and you're going to repeat them immediately after I tell you the words.
Okay, so you tell me the words and then I tell you back right away, right?
Yes. So the words are apple, watch, and penny.
Apple, watch, penny.
That's correct. Okay, very good. Now, what I want you to do, I want you to draw a clock. Okay? So we're gonna do it on the board. Okay, you're gonna start by drawing a circle. Okay.
Circle.
Circle. Right. And you're gonna put numbers inside of the circle, like
What
you would
numbers?
in a clock.
Oh, clock. Okay.
Uh-huh. And I want you to put 2 hands saying that it's 11:10. The time
Okay.
is 11:10.
That's so easy.
That's good.
There you go.
All right. Okay. So now, do you remember those 3 words that I told you?
The 3 words.
Could you repeat them for me?
Яблоко. Oh, apple. And the other one was clock. And I think it was $1.
All right. Okay. Okay, good. Do you feel that you had any difficulties with exam?
Oh no, I did great. Look at this perfect clock.
Okay. All right. All right, we're done for today. Please make sure you adhere to your blood pressure medications.
Okay.
To control
Can I
your
eat candy?
hypertension. Yes, you can eat candy.
Okay.
And we will evaluate your results and we will call you for follow-up.
Okay, thank you very much.
Okay,
Thank you.
It was
Thank
good
you.
to meet you.
Have a good day.
Okay, we completed the test and Mrs. Gritchell was able to recall 1 out of 3 words. And this is the clock drawing that she did. She got 4 out of 5 points because she did not draw the time correctly. It was
Okay.
supposed to be 11:10.
Okay, so we just need to do further evaluation.
Okay.
I'll let her know. Thank you.
Thank you.
The prevalence for cognitive impairment depends on ethnicity. For African Americans, cognitive impairment reaches 17%, while the prevalence for white non-Hispanics is at 9%. Prevalence for dementia among African Americans is also higher and reaches twice the levels than that among the white non-Hispanic adults. For Alzheimer's disease, African Americans have a prevalence of 2.5 times greater than the prevalence among white non-Hispanic adults, 14% versus 6%. In addition, risk for Mexican Americans is similar to that as white American prevalence, but Mexican Americans tend to exhibit mild cognitive impairment at an earlier age, and often it coexists with depression. Besides the differences of the prevalence between different ethnic groups, cognitive impairment tends to have higher estimated lifetime risk of development in females. These high prevalences of cognitive impairment caused Medicare in 2011 to add detection of cognitive impairment to the new annual wellness visit benefit. And the Alzheimer's Association also helped them by publishing guidance on how to implement this benefit.
So the USPS concludes that the current evidence is insufficient to assess the balance of benefits and harms of screening for cognitive impairment. According to the USPS, DF, dementia affects approximately 2.4 to 5.5 million Americans. Its prevalence increases with age, and it increases to 5% in persons aged 71 to 79 years, and 24% in those aged 80 to 90 years. Approximately 40 to 50% of older adults report subjective memory symptoms, and 60 to 80% is estimated Alzheimer's disease of all dementia cases. 11% of adults older than 65 and 32% of adults older than 85 have Alzheimer's disease.
And
Any
which,
questions?
yeah, I have a question. What model is applicable to the screening?
Well, the most appropriate one is the health belief model because it addresses the patient's unwillingness for the screening because their perceived susceptibility and perceived severity. So perceived susceptibility is they don't think they have a cognitive impairment, so they don't see the reason to. The perceived severity is that the safety, if it's not diagnosed, they don't believe that it's really going to make that much different, and that's what affects it. So different aspects that are involved in the health belief model that we can apply is the screening behaviors. So those ones
that you were performing. So those are like the mini credential exam, the clock, and all those that we were talking about earlier. And then also encouraging adherence to treatment plans. So making sure they're taking their medication, and also ensuring that they have visits set up afterwards for checkups. And then just promotion of health as well. So we want to make sure their diet is appropriate. They're really trying to maintain healthy brain activities to just promote healthy aging as well. And then just screening behaviors we were talking about earlier. And then our goal as CNLs is to make sure that we're promoting education. So this is to the RNs and the patients and the caregivers, just their understanding of what's happening, and just to be able to have these kind of meetings, like interdisciplinary, to make sure that everyone's on the same page and everything. So this is the primary ways, and this through our involvement as CNLs, patient education has increased by 30%. So we really believe this is important to just making sure everyone's on the same page. As far as adherence to the screening, it's because it's inconclusive. We can't really be promoting this necessarily, but we need to be promoting research to try to just be able to decrease the amount of undiagnosed cases that are happening. So it's the most important part.
Sounds great.
Yeah.
Thank you for educating us.
so much.
We're going to be on the lookout.
Awesome.
Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time.